Well, the number of people in hospital with COVID-19 we've been reporting this morning is on the rise. Between September 15th and October 15th of last year, daily hospitalizations because of COVID sat at 2,000 a day. Well, let's compare that to the same time period this year, the average at 4,700 a day. For more, we're joined by Dr. Abdu Sharkawi, infectious disease specialist. Good morning, or should I say welcome back?
Thanks for having me, Anne-Marie.
Nice to have you back. The hospitalizations, as we just reported, have almost doubled since last year. What do these numbers look like on our hospital floors? We know that there's staff stretching and staff shortages there, too.
Yeah, unfortunately, what this means is a return to what we call dedicated COVID teams, which means that these are units that are specifically designated for managing COVID-19 patients, and that requires dedicated staff as well. And that's difficult because I think it's quite clear to everybody at this point in the pandemic that our healthcare resources have been stretched very, very thin. And it's difficult to deploy nurses and physicians and others who are going to be able to manage these patients, many of whom are still quite sick. We don't see patients dying on ventilators that commonly anymore with COVID-19. But we still see patients getting very, very sick and exacerbating their underlying conditions. And that's something we really need to take very seriously with an upcoming respiratory virus season that's probably going to be a lot worse than anything we've had in the past several years.
That is shocking news to a lot of people who, right now we're living in a time with no masks, less restrictions. But winter always means an increase in spread as more people move inside. And again, there's no, limits on people and the amount of people in the space. So because there's no official recommendation, what can people do to protect themselves?
Well, the good thing is we know what to do, and there's a lot of different things you can do. You can start in your own home, and that means making your home environment as safe as possible if you're going to have outside contacts. And that means you don't have to open your windows wide open, but you can crack them open enough to make sure there's a lot of airflow. If you can have HEPA filters at home, that really helps enhance the air quality. And if you have a CO2 detector, that'll tell you how good the air quality is in your home. It's a little handheld device. You want to aim for numbers that are under 800 and ideally get as close as you can to 400 because that's what it's like outdoors. And that's fantastic. I've had my kids have, a friend over and they're able to play and hang out together, and they can do it safely because we use HEPA filters and we try and open windows within a tolerable degree. So it's manageable. Having rapid antigen tests for use at home is also very important, and to swab not only the nose but the back of the throat, because a lot of people are now presenting with sore throat as the main symptom. So don't rely on just a swab within the nose and keep testing. If you're symptomatic, don't rely on one negative test alone. And when you're outside of your home, wear a mask. I know that a lot of people have sort of tired of this practice, but it's kind of intuitive. There's a lot going on out there. Anyone who's had kids in school knows they've brought home sniffles, sneezes, coughs, etc. My kids have been sick more in the past 6 weeks than they've been in the last 3 years in total. So I think wearing masks is very helpful and it's important. And lastly, get your vaccine. Get updated. We're really almost spoiled right now that we've got bivalent vaccines available to us. The Moderna product has been out for a while now, and the Pfizer bivalent is going to be readily available to a lot of people any day now. So get updated. If you've had COVID within 90 days, you may need to wait. But if you haven't, go get that vaccine and talk to your healthcare provider about when it's optimal to do so. There's a lot we can do here to curb this and make our winter safer.
A timely reminder, Dr. Sharkawi, good to have you back with us. Thank you.
Thanks for having me.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.